Well, welcome everybody. Thank you very much for coming to this meeting. So to those of you who don't know me, my name's Jackie Applebeeh. I'm a GP in Tower Hamlets and I chair Doctors in Unite, which is the doctors branch of Unite the Union. Other speakers will be talking about the campaign that we're running, but thank you very much for joining this meeting, this very important meeting this evening to end the commercialisation of the NHS, get Centene out of the NHS. You'll hear all, if you don't know the story already, you'll hear all about it during the meeting, and then I'll talk a little bit at the end about some actions we have to keep the campaign going and the sorts of things we need to be doing. But without further ado, sorry, and the way the meeting will run, there'll be 10 minutes for each speaker. We've got Richard Buckwell, who is the chair of NOTS KONP speaking. We've got Dr. Louise Irvine, who's a GP in Lewisham and involved very heavily in Keep Our NHS Public and health campaigns together. We've got Rabina Khan, who's a councillor, Liberal Democrat councillor in Tower Hamlets. We're hoping to have Antonio Pérez-tranzo, who has been involved in the campaign against Centene in Spain, to tell us about their experience there already. And then finally, Jeremy Corbyn, who needs no introduction. Thank you everyone for coming. So speakers will have 10 minutes each, no more, and then there'll be time for a discussion from the floor. We aim to finish at 7:30. So thank you very much, everyone. I'd like to hand over to Richard Buckwell, who is chair of NOTS KONP. Thank you, Richard. Oh, and can Maggie or Campus unmute Richard? Thank you.
Right, that's better. Hello, I'm Richard Buckwell. I'm, as mentioned, chair of Nottingham and Notts Keep Our NHS Public. You might wonder why I'm starting off from Nottinghamshire. I'm sure quite a lot of you are from London. Well, you'll find out very soon. To start off, in October 2015, Centene got their introduction to NHS England when they were invited to an event co-organised by NHS England about something called New Care Model Programme. This was led by a certain Samantha Jones, and you might hear a little bit more of her later tonight, and the NHS Confederation. And moving swiftly on from this, early 2016, Nottingham became a pathfinder, in layperson's terms, a pilot, for introducing this New Care Model Programme, which soon became to be called Sustainable Transformation Programme. Some of you might have heard of, but with all these acronyms you get in the NHS, it is now very much what is called the Integrated Care System. Central grant funding was to pay for this consultant, and guess the name of the consultant employed and promoted at no local cost to the NHS, and this was called Centene. So who are Centene? There are further details I'm going to post in the chat when I've spoken. Two very good articles from Stuart Player, who had them published by the Socialist Health Association. But there are some important points you need to know about them as I talk. Many of you will only first heard of Centene earlier on this year with the GP takeovers in London. But Centene are a US health insurance company now with an annual income of 2/3 the income of our NHS, so they are big. They made a great leap forward as a company under Obamacare and became the market leader in the US Medicaid managed care. And this private sector administration of state services for particularly the poor, pregnant women, the elderly adults and people with disabilities. And there are huge similarities between Medicaid managed care and integrated care systems. So how do they make their money? Stuart expands on this, but I'll just go through it very briefly. First off, reducing the quality of care. Well, nothing new there. Secondly, control of the regulatory environment through political lobbying, donations, and a revolving door between the state and corporate institutions. So again, nothing new. Failure to comply with regulations, I think some of these were listed on the flyer. Reduced reimbursement rates to medical providers, minimizing provider networks, exclusionary contract language, much of the language the NHS use, I think, could be counted as this, and reducing and denying care, particularly for the most expensive patients or most expensive care needed. There are plenty more examples documented by Stuart, and I'm sure some of them will come up tonight, and I'll probably refer to some of them as we go into the discussion about what they're doing here. But back to the Knots experience. Before their appointment, we got wind of their record in Spain, and hopefully we'll be hearing more about that, where they got a 90% shareholding in a Spanish company called Ribera Salud. And they had a contract with the Valencia Regional Health Authority, but their performance was poor and it was taken back in-house. So as a group, we campaigned locally when we heard about their possible appointment, saying, why on earth are we appointing a privateer whose services have had to be taken back in-house? And what were they going to do in Knots? Well, as an insurance company, they intended to carry out an extensive analysis of all the work streams the NHS provided locally. And I'll list some of these so you can see what areas of work they were going to be looking at. Patient pathways, population health management, social care integration, IT services, provider payment models, together with governance and contract design, all absolutely vital to providing not just a local health service, but to providing a health service anywhere in England. And clearly a Trojan horse, not just for us locally, but for everyone nationally. And it is no surprise that the lead Chief Executive for our ICS, David Pearson, has now become a central NHS advisor. But like many other integrated care systems, since being drawn up, there hasn't been a lot of evidence of what they've delivered. Delayed initially, pleased to say, by KOMP's judicial review over lack of consultation, their lack of statutory footing, which the government hoped to remedy from their point of view in the new health bill. And there are many impossible dreams of cutting beds to fund community care at the same time the NHS was going through its usual health emergencies with A&E clogged to the rooftops. And then, of course, we were hit by COVID 18 months ago. So you might have not heard what was happening, but Centene was stealthily getting on with things in the background. And this came to a head in Knots last November. There was a contract for a surgery called Platform 1 in Nottingham City Centre. It's an extremely good service. It's been running 10 years, but the CCG said they could no longer afford to fund it the way it had been funded, despite it having an outstanding assessment by the Care Quality Commission. It was extremely well thought of, but the new contract was only going to offer 40% as the funding they already had. And the CCG refused to share its equality impact assessment. And when we did get it, it showed that every protected characteristic required for an equality impact assessment would be worse off under the new funding arrangement. There was outroar when it was taken to the city's Scrutiny Health Committee. GP spoke out, Health Watch spoke out, quite unusually, the voluntary sector up in arms, and there were articles in the BMJ magazine and other national publications. And it was during this process that we identified that Centene might well be one of the companies bidding to take it over. And we discovered and heard about Operose that they set up to take over GP surgeries, and discovered they'd set up 5 in Nottingham in the last 18 months we hadn't realised. All in poor areas. Some of these surgeries didn't have GPs on their staffing and still don't have GPs on their staffing. They're served by locums as and when they need them. And they have 3 more contracts which are due to come up at the end of this month very soon. And we've heard one of them has already been taken over by Centene. So they were gunning to take over services. The scrutiny panel demanded they come back in December and provide a further report. They did come back in December, but, and this is what regard they had for democracy, they had already awarded the contract. Fortunately, because of the uproar, not to Centene, but to the local federation of GPs, but they've still got to cope with a 40% cut in funding. And also, as part of the measure to make this new surgery work, 3,000 of the 11,000 patients have been dispersed to other GPs, despite the fact that they chose to join this surgery in the centre of Nottingham. So the CCG have no regard for listening or democracy, and this is a big worry about what's going to happen in the new health bill with the ICSs. It can only get worse. But it does show that if you speak up and campaign against these things, you can prevent Centene having an inroad. And I think I want to finish on a positive note, that we've had experience in Nottingham of campaigning on issues. We stopped Centene getting this surgery. We wanted to stop getting more. But we've also stopped other privateers developing in Nottingham. We're pleased to say we got rid of Carillion when they managed major surgeries in our hospitals. And that was after a really innovative campaign with Unison Unite. We also got Circle taken out of the treatment centre, which they'd run since inception. And again, something we only discovered afterwards, Circle are 40% funded by Centene. So there are great worries here. But again, looking on the positive side, the thing about GPs, all of us need and use GPs. They're a service everyone uses. There's a service that can unite our opposition to what is happening to the NHS at the moment. And I urge you all to campaign locally, exposing the predators that Centene are. So I'll leave it at that. Happy to answer any questions later on. Thank you.
Thank you very much, Richard. And it just goes to show, as you say, that if you fight, if you fight, we can have victories. And it's really, really important to fight so that we don't, we push back against this. So thank you very much. So our next speaker is Dr. Louise Irvine, GP in Lewisham and a fantastic NHS activist. So thank you, Louise, for joining us.
Thank you for inviting me to this meeting, and thank you, Richard, for that very interesting account of what's happening in Nottingham. I've had to cut my speech a bit. There's so much I could have said, so I've taken out bits that I think other speakers are covering, and if I don't cover something, hopefully I can answer in the questions. So just to recap, in February, campaigners discovered that Operose Health, a subsidiary of the US health insurance giant, the Centene Corporation, had taken over 49 AT Medics GP surgery sites in London and the South East. So across England, Centene now control 58 practices, covering 500,000 patients, making them the largest providers of primary care in the English NHS. The method Operose used to take over the practices was to take over the holding company that owned AT Medics. They replaced the directors of AT Medics with Operose directors, including Samantha Jones, who Richard mentioned, who was at that time the Operose chief executive. She then resigned a few weeks later and is now an advisor on health to Number 10. Talk about a revolving door. Patients and campaigners backed by local councillors and MPs have since mounted a wave of protests outside local surgeries, as well as targeting the headquarters of Operose Health on the 22nd of April. Keep Our NHS Public, 999 Call for the NHS, We Own It, and numerous local NHS campaign groups have been involved. Another day of protest is planned for the NHS anniversary on the 5th of July. In May, lawyers for Islington patient and counsellor Anjana Khurana filed a claim for judicial review against NHS commissioners for allowing Operose Health to take over these NHS contracts. Her case is backed by Keep Our NHS Public and 999 Call for the NHS. We're still waiting to hear if a judge will give permission to go forward to judicial review. The case is based on three main areas: lack of consultation, inadequate due diligence into Operose's financial standing, and lack of information on what Operose will do with patients' medical data. There have been so many battles in defence of the NHS and many more to come, but it's clear that GP surgeries are now a key battleground in the privatisation of the NHS. General practice is different from the rest of the NHS, but it is not true to say it is all private anyway, so it doesn't matter who owns the contracts. Traditional general practice is run by GPs, and the income they get goes towards their pay, staff pay, and running the practice. There's no profit for shareholders. From 2004, legal changes to GP contracts meant that for the first time, private companies could get contracts to provide GP services. The contract that was seen as the gateway for the commercial sector into general practice was the Alternative Provider of Medical Services contract, known as APMS. Unlike traditional contracts, anyone with no previous experience of providing GP services can get an APMS contract. The majority of Operose GP contracts are APMS contracts. There's a world of difference between traditional general practice with community-based GPs providing personal, continuing care, and a giant remote commercial company such as Operose. Operose is owned by Centene Corporation, a US health insurance giant. Operose is a loss-making company that is financially dependent on Centene Corporation. For example, Operose's 2019 accounts show that it made losses of nearly £7 million, such losses being set off against future profits. In the same year, it received cash funding of £9.5 million from Centene. The 2018 and 2017 accounts also show Operose operating at a substantial loss with huge cash funding from Centene. Needless to say, Operose's losses mean it doesn't pay UK tax. Operose has no existence without Centene and is Centene's foot soldier for its incursions into UK healthcare provision. Centene Corporation itself is worthy of a closer look because of its history of fraud, inadequate coverage, and poor quality healthcare in the US. It does not engender any confidence in its integrity or suitability to provide UK health services. There's no guarantee Centene will continue to fund Operose, especially if it continues to be unprofitable. Operose's business strategy stated in its accounts is to divest of activities that have not met profitability targets. As a result, on the 31st of March 2019, Operose Health Limited exited the Surrey and Borders Partnership NHS Trust Child and Adolescent Mental Health Care contract. At the end of June 2019, it exited the Surrey Borders Partnership CFHS contract. And in July 2019, it divested its complex care service division. It's hard to profit from general practice without operating at scale and downskilling and downsizing staff, because the only way to make a profit is to cut your costs, especially staff. And in particular, replacing GPs and nurses with less skilled and less costly health practitioners. This is unpopular with patients. They prefer the traditional model based on continuity of care with a known GP. This model is in danger of being swept away by the new kids on the block, huge profit-seeking corporations like Operose Centene. However, given the difficulty in profiting from general practice, as seen by the exiting of many other organizations that tried, it's likely that Centene has other interests in this area. For example, use of patient data in developing population health management programs. Centene's CEO has said that Centene is a, quote, technology company focused on healthcare, unquote. And with the health data of 500,000 patients, there's plenty to play with. Another could be opportunities to develop integrated care systems, given Centene's interest in such systems, which Richard explained, with its stake in the Ribera Salud Alzira Accountable Care organization in Valencia, Spain. The Alzira model, interestingly, it's been lauded by UK health leaders as a model for integrated care systems in England, which upcoming legislation will make into statutory bodies. Incidentally, Centene's Spanish ACOs have now been taken back into public ownership, which suggests they did not fulfill early promises of improved care. Whatever the reason for Centene's interest in acquiring dozens of GP practices, the scale and nature of the takeover is a major change in the way GP services are being organised and delivered, and is the shape of things to come unless we oppose it. To campaign against this, we must publicise what's happening through public protests, petitions, local press and social media. When patients find out, they're very angry. General practice is close to people's hearts. Our JR fundraiser raised over £40,000 in about 4 days, which just goes to show how popular this cause is. We hope our JR will go ahead, but even if it does not, there's still much to be done. We must challenge each and every instance of APMS contracts coming up for renewal and demand that there's local patient and public consultation on the kind of organisations who should be allowed to run our GP services. We must campaign against the upcoming NHS bill and in particular against integrated care systems. Specifically on general practice, we should campaign for amendments in upcoming legislation to abolish APMS contracts. This would not be sufficient, but would be a good start. General practice is in crisis, underfunded and understaffed, which is why so many smaller, struggling practices were vulnerable to corporate takeover. We must ensure we include general practice in all our campaigns for proper funding for the NHS and proper pay for NHS staff. Keep Our NHS Public is working on a charter for general practice and will be including general practice in our updated rescue plan for the NHS to be launched in the early autumn. This is only the beginning of our campaign to defend general practice and kick the corporates out. Thank you.
Thank you very much, Louise. And it was a really comprehensive sort of description of what's happening. And thank you very, very much indeed. And I think, as Louise says, these APMS contracts have to be taken on. So wherever you are, if you've got to, if you're active in your local health activist group, KONP, you know, fantastic. If you're at this meeting and you're not a health activist but you want to become one, there's probably going to be a group very near you. If you go onto the Keep Our NHS Public website, you can see. And if there's not one, just get a couple of friends together and make one. Just set one up, because you know, we need these things challenged wherever they are, and they come up. They will come up regularly over the years. The contracts are time limited, 10, 15 years. So they will be coming up at a GP surgery near you soon, I am sure. Okay, just to say, Richard, thank you. You put some articles in the chat. The chat isn't enabled for everyone. So Stuart Player's article that Richard recommended is on the Socialist Health website, sochealth.co.uk, and it's Stuart Player, Centene, the real agenda, what to expect. So if you want to look that up, please do. Okay, so thank you very much. So Louise, and then the next speaker is Rabina Khan, who is again very active in NHS campaigns. She's always out with us in Tower Hamlets when there's anything to be campaigned for with respect to the NHS, and she's a Liberal Democrat councillor in Tower Hamlets Council. So Rabina, thank you very much for joining us, and good to hear what you've got to say.
Thank you, Jackie. Thank you for inviting me here. And I wanted to speak to you, not just as a councillor, but as from my lived experience of using the GP, and also standing up for people who are using GPs owned by some of these contracts. So Louise gave a really good account of a GP practice, and also referred to the practices, 58 practices. Well, one of those practices is my GP, East One Health, and I was out there campaigning outside East One Health. And the reason I'm so passionate about this is because I've seen firsthand the effect of these privatisation by stealth, the impact on the lived experience of patients. So let me just give you a little example of my own self. I didn't know that these contracts were coming in. I didn't even know that this was happening, and I'm a councillor. And it came gradually, bit by bit. And it happened under the lead up to COVID, under the pandemic, when people wouldn't have been aware. I had COVID. I had I'm a long-term COVID sufferer now. I had a very serious COVID back in December. And just before I fell ill, I started getting these pains on my left arm. And I kept asking for an appointment with my GP. And it was, you'd ring up in the morning at about 8:30, and you'd be on the phone for about half an hour, 45 minutes, up to an hour, trying to get this appointment with East One Health. And me, as someone who can access the phone, it's easy, but for someone who's not who's elderly, who might have a disability, the impact on that person is enormous. And so eventually, when I did get an appointment, you can immediately feel that this isn't the same GP or the same practice I had. It was, well, you know, we'll give you a call back, we'll give you a consultation. And I just wanted to give you a back history of East One Health. 30 years ago, I moved to the borough, 91, and the East One Health was originally Bernardo Gardens GP surgery. It's the old-fashioned kind of traditional concept of care and seeing someone face to face, someone you knew. It was continuity of care. It was the receptionist you knew. You rang on the day and you could get an appointment on that day. And I still remember how Dr. Basu, who ran it from a flat in Bernardo Gardens, that eventually moved on. It was regenerated, that area, and it went to Cable Street Surgery. And that is how it all, you know, that's the back history of it. And I've seen this practice go from this little flat onto becoming East One, and now it's privatised. And we, as the patients and as a counsellor, I can see what's happening. I have, for example, a constituent very, very desperate to be in contact with the GP because her husband has a disability. We need the support of the GP to verify his condition so that I can put forward a housing case. She's been unable to get an appointment because she's been told several times you have to ring the next day. If you're in the queue, then we'll be able to give you an appointment, or we might give you a call back. Today, I campaign on cladding as well, and I met this gentleman who's 83 years old in my ward, and he said to me that he took care of his wife. She had dementia because he was so fearful of what the NHS had become and what social care had become that he would rather give that care himself. An 83-year-old man looking after his wife. She passed away a few years back, and what that brought to me, as I thought about this evening's meeting, is the way it's affecting older people, people with disability, people whose first language is not English, to access that traditional good care at the GP. I was talking to my mum a few weeks ago, and she said there was a time that a GP would make that call to your home, would make a visit. Okay, I understand it's COVID, but they don't do that anymore. That's not what the NHS was about. The NHS was about making sure there was compassion, there was a sense of careness in delivering that service, and that's not happening. And I'm going to give you an example. As a patient of East One Health, I got this letter, and I'm happy to share it with people. And in the letter, and my whole family got this letter, my daughters, my husband, my children, you know, they all got it. And it talks about important information about your practice, about East One. That's going to move to Goodman Fields Health Centre. And it's asking us, and I can read this letter, to go on and find out more in a drop-in session with Zoom, through a Zoom. And first of all, some of the elderly people who are going to get this letter don't know how to access Zoom. Secondly, people whose first language is not English, who find it hard to access services, they won't know how to access Zoom. I mean, Zoom is a new way of working. We're all trying to get accommodated with it. In the letter, it also says, what does this mean for me? It means that your healthcare will be provided from much better quality premises. Okay, I accept that. We're going to move into a new health centre, brand new health centre. It will allow the practice to expand the services delivered over time and have more clinicians to help you with your health. It will mean the practice will be able to offer patients the choice of seeing a wider range of team members to support their health and social needs. That looks like a really good package. In reality, I don't believe that's the case, because if it was the case, they would have made a really big effort to consult with elderly people, to consult with very vulnerable people. And when this letter talks about, we will expand these services, it's not telling me, will it cut back on the waiting time? Will it cut back on making sure that we can, where we don't see GPs, that we can see GPs? This is, to me, is what someone from a private industry would send out. It doesn't give me anything more. It makes it all very, 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 tied up with a ribbon. And I don't believe that's the case. And now we've seen Matt Hancock resign. Well, let's hope Mr. Javid, who's now in charge, he's going to have to contend with COVID, NHS reform, the battle over pay, the appointment of a new NHS CEO, and not least the massive backlog of treatments. What we want for this borough, for our GPs and the GP that I'm connected to, that I'm a patient of East One, we want continuity of care, and we want to make sure our NHS stays public, it's not privatised, and we certainly don't want any of these contracts. So I'll stop there, Jackie.
Lovely. Thank you so much, Rabina. Thank you so much. It's really important to hear that really personal account, to think of what this actually means on the ground. And you're quite right. And I'm a GP, and traditional general practice has served us really, really well. As Louise talked about, the continuity of care and the going out and visiting the elderly, everyone being able to access us. And the NHS has been so squeezed by this government, so squeezed, over the last 11 years. And we hear so much about how the hospitals are in crisis, general practice is in crisis as well. And I'm not proud of the service that we're offering at the moment. I mean, and that again is, we need to be able to get the NHS invested in. It's the NHS 73rd birthday on Monday next week, and we're going to be having in London a protest outside the Department of Health. If any of you are in London, please come down and join us 6 p.m, because we have to have the NHS taken back into public ownership properly and invested in properly. Okay, so thank you for that. Just a couple of questions have come up before I bring in Antonio. This meeting is being recorded. I'm sorry, there was a problem with the Facebook link. I don't know what happened there, so apologies, well, actually not to all of you, because you've got in, so all the people who aren't here, who I can't apologise to, apologies to them, but we will be putting it up so people can watch it later. I think we probably put it on the Keeper NHS Public Facebook page, and we'll tweet it as well and put it on YouTube. Very, very quickly, to Tara Alec in the chat, it's never too late to campaign. Please get in touch with us. We're North East London as well, and I think you're in touch with some of us, so please get in touch with us. APMS, what does it stand for? It's hard to go into that now, it's quite technical, but it stands for Alternative Providers of Medical Services. It is what it says on the tin. It means that an alternative provider such as Centene or Atos, and it can provide the services, and they were brought in 2004 as the slippery slope towards commercialisation has been descended, and we've got much further down that slope since then. So we have to push the NHS back up to the top of the slope. Okay, so we've got 2 more speakers left, and then we'll open it up for a bit of discussion. So we've got Antonio Pérez-tranzo, who is speaking to us about the experience of Centene in Spain. Antonio, I'm really sorry, I don't know the name of the organisation that you're from, so huge apologies. And if you'd just like to introduce yourself, that would be fantastic. I think we've made you a co-host so that you can share your screen. So if you could speak to us for about 10 minutes, that'd be fab. Thank you.
Yeah, can you hear me well?
Yes, you're fab.
Yeah. Hello, my name is Antonio Pérez-tranzo. I represent the Federación de Asociaciones para la Defensa de la Salud y la Sanidad Pública in España, which means it's a social platform of federation of different associations to the defense of the public NHS, kind of a public NHS in Spain. I'm actually talking mainly on behalf of Marciano Sánchez and Pedro Lorente, who are the real fighters, and they really know much more than I do, but maybe because I can speak a little bit more English than they can, because I have been selected and named as the talker. I'm a consultant in the Hospital General de Castellón in Spain, and also I'm a pediatric intensivist consultant at the Birmingham Children's Hospital in the UK. So I kind of know both systems. Just wanted to talk you briefly about our experience with the Ribera Salud experience, and therefore with Centene multinational. This model was born in Valencia in 1997 in the area of La Ribera. So that was the system. The name arises from the hospital that was created by Centene International. They also, it's not only, they not only run this hospital, but they also run three other hospitals in Valencia, 3 in Galicia, 1 in Madrid, 1 in Extremadura, and also we have known that they run 1 in Callao in Peru. They were trying to develop 1 in Montevideo that we were able to stop in cooperation with other associations there. They also done 3 laboratories in Madrid, Prague, and Bratislava, 1 hemodialysis center in Alicante. So what is the Alzira model? Well, I think I've been listening to your talks before, but essentially it's a public to private collaborative system in which the enterprise, in this case Centene, invests and builds a hospital, and in exchange they obtain the right to run this hospital for a certain period of time. In this case, there was an initial contract of 10 years, which was actually prolonged to 20 and 30 years. And it was not because they were doing well, but we believe that there were a lot of unknown and deep silent associations between the different powers in Spain. In exchange of just running the hospital, they will receive an annual capital payment per theoretical patient. So in this case, I think in 1999 it was around 250 euros per patient, and then the other option for getting money as well is just some payment per procedure as well. So if they would treat patients for different areas, they would get an additional income. There are other variants for this as well. They've been trying to control the primary care, sociosanitary attention, and they also try to extend to other areas, for instance, in Galicia. So how do they make money? I mean, well, there are 2 options. So they get money for every possible patient that they would be able to treat. So obviously the way of making money in this option would be just to reduce the cost. And how do they do that? Obviously, they were and they have been known to hire less nurses, less doctors, less skill, reduce the skill of the nurses. They had the full control of who they would hire and in which conditions as well, and essentially they would reduce the quality of some of the treatment they would deliver. And the other possibility for making money is obviously they were just attending, offering different procedures, and what they were doing was essentially to deviate these procedures from the public areas. So, for instance, it was very well known the case of the vaginal deliveries for children. So essentially, they started to promote these deliveries in Alzira, and essentially they hired a bunch of anesthetists who would deliver epidural anesthesia, and in cooperation with some political powers who would reduce the anesthesiologist in the public hospitals. Therefore, if you would go to Alzira, you would get the epidural guaranteed. So these had a call effect. So a lot of mothers went to Alzira and delivered their children there, and that resulted in an increase of the deliveries in Alzira to 37%, while the public hospital would only have an increase in the deliveries around 0.7%. And those that have been contrasted. They would also have some contact that happened, for instance, in Madrid with some call centers, medical call centers, which were also private. So they would get more patients deviated from the public system to the private hospital. In contrast, what they would do with other less productive activities or patients, those were not convenient for them. So those ones were deviated to public hospitals like Hospital La Fe of other ones. And there is an additional way that they would make money, is just via pharmacy. So all the drugs were bought centralized via different intermediaries at lower cost. This is very interesting because essentially the B2B, which was the center for buying different drugs, now it's being sued and it's on court due to many irregularities. So essentially, they would just buy the drugs at lower cost and sell them at higher cost at the pharmacy, just like it would happen in a private pharmacy. And they developed very progressed techniques to hide the real cost and to hide the overall loss of money that they were just performing. What were the consequences for the public system? Well, the hospitals, those hospitals would have lower numbers of beds in relation to the covered population. And as I mentioned, in these private hospitals, there were lower staff ratios compared to beds or patients than in public hospitals. In Spain, in Alcira, for instance, there were 2.5 times less doctors, 2.2 less nurses, and 1.6 less health assistants, and 1.6 non-health workers as well. And they progressively would increment those costs, and they normally would be allowed to get a low per capita payments, which I think was initially 200. That was increased to 300 within time, and after some time, the cost increased 6 to 8 times the overall cost. In contrast, some of the beds were blocked in other public hospitals or just eliminated in order to have more patients sent to them. It's funny that you have mentioned, and actually I didn't know what was the translation of puertas giratorias to English. And actually you have a name for that. It's revolving doors. And we Spaniards thought that this was something that only happened in Spain, but actually I'm surprised to know that it also happens in the UK. And so the person who was, there was a nominated person in the Consellería de Salud that was supposed to monitor the results of Alcira Hospital. And guess what? That person ended up being the director of the Alcira Hospital 4 years later. So essentially, those companies, Centene, does not really play clean. I can tell you a lot, and I could talk hours and hours about the corruption of our Valencian governments run by Partido Popular, and the way that this Alcira model was like the big ship, like we call it buque insignia. So it was the mark of the Partido Popular. And it was clear, and has been shown later in trials and courts, that there was a illegal association of some of the people in the power with this company. So it's not a fair play. It's not just a laissez-faire, as the French say. Is really a fair play with a private company sharing profit with some corrupt politicians, like it happens here. For instance, the UTA Rivera Salud Association was mainly run by Rivera Salud, which hold the 96% of the holding, also by two small Spanish companies, building companies as well. And this Rivera 96% was obviously not other than Centene Association, Centene multinational. So how was the model reverted? There was a joint effort of syndicates, union, patients association, some political parties as well. I think we used the end of contract. That contract was prolonged. Initially, it was planned for 10 years, was prolonged for another 20 years, in the spite of the big expenses and loss of money and it was actually rescued by this that corrupt Valencian government. Essentially, we lost lots of money on that. But the politics in Valencia and the Valencian community changed. And as I said, as a result of this combined effort of different associations, in 2015, there was this end of contract was used as a narrative by this three-party meeting in order to finish with this contract. We must say that despite the fact that there was this end of contract, there were more than 100 judicial or processes, legal processes started. There was press campaigns against the process. The enterprise created a false social platform, a ghost platform, which kept organizing demonstration to keep Centene running Alzira. And there was even some international political pressure by the USA ambassador against the political Valencian government. And I can say that in the moment there are two other hospital reversion in process. So, as summarizing message, this Alzira mobile definitely worsened the assistance, increased the cost, and weakened the public sanitary system around it. It definitely puts the commercial interest up from the public health system and put our system in risk. And there are definitely alternatives for its reversion, but it requires a joint effort and a political effort. I think that's all from me, and I will be happy to take some questions. I think Pedro Lorente, who is my mentor in all of that, and he knows much more than I do. And I'm not sure if he would like to ask or to add something to what I say. Thank you very much.
Thank you so much, Antonio. Thank you so much for coming and for persevering with joining the meeting as well. That was really interesting, and it just goes to show, doesn't it, how these companies are global, they're multinational, and they're trying to get their claws in everywhere. So thank you so much for sharing your experience there in Spain. Okay, so we've come to our final speaker, who needs no introduction. We've got Jeremy Corbyn, who's the best Prime Minister we never had here, and it's really lovely to welcome Jeremy along to speak. And Jeremy's been really involved in this campaign as well, and has been really active on this campaign. So thank you so much. I'll stop burbling on, and yes, thank you, Jeremy.
Jackie, thanks so much. And thank you, Antonio, for what you just said about the campaign in Spain. Buena suerte los militantes de España para la salud para todo el pueblo. Okay, ¿está bien?
Thank you.
Jackie, this is a fantastic call, fantastic meeting. By my calculation, there's over 500 people at this event now online. Just imagine if we weren't in the middle of COVID, we were in a public meeting hall with 500 people, all pulling in the same direction on health campaigning. You get that sort of sense of solidarity and presence there. And so well done you on organising it, and well done everyone for being here today. There's so much could be said, but I'll try and be brief so we've got time for people to give their own points of view and their own experiences, which are there in the chat box. This is an incredible challenge to our NHS, what is now going on. I challenged the Prime Minister 2 years ago on this and saying, you're going to sell off our NHS to American companies. And he said I was scaremongering and talking nonsense. If anything, I was understating the case and understating what the threat was about. That was when I revealed the trade deal documents that he was negotiating at that time secretly with the United States. And what they were saying was that any trade deal with the USA would involve the access to the UK health market. Well, they've already got access through the Health and Social Care Act and through the decisions made of Jeremy Hunt, of the succeeding health secretaries after that, including the unlamented Matt Hancock, who's now finally left office. And I sent a tweet out today to acknowledge Sari Javid taking over and ask him not to follow in the footsteps of the others and privatise the NHS, and also, while he's on with it, to resign from any banking directorships he might have. And that tweet has already had 2 million people look at it. And that I'm not interested in anybody's personal lives. I'm only interested in what they're going to do politically, what happens to our National Health Service. Now, GP surgeries are the ones at threat at the moment. I'll just say a word about that and I'll come on to a wider issue. One of the fault lines in our NHS was the deal done in 1948. We all know the reasons why it was done. The history shows the pressures that were on the government at the time, that were on Aneurin Bevan at the time, and that was to give the GP practices essentially a contracting relationship with the National Health Service. And for most of the public, most of the time, most GPs, as far as they're concerned, are just part and parts of the NHS, just like anybody else. They don't actually often understand what the difference is. But it's when companies begin to get involved, it's when companies take over, it's when the issues of ownership of property and control of property of GP practices, and then the wish of local health authorities to have wider issues like walk-in surgeries, wider practices and so on, that it becomes very apparent that you're actually dealing with, in often individual cases, the private sector. But we now have this takeover of our GP practices by Centene, otherwise Operose. And there is one in my own constituency, it's been taken over. I've said this before, so others will have heard it. We had a salaried GP practice on Hanley Road in my constituency. It's just quite near my office, actually. And I was very proud of that, because I think salaried GP practices are the direction we should go in. A doctor should be employed by the NHS just like anybody else. And therefore, their loyalty lies totally with the NHS, not with developing a small business of their own. This was then taken over by Centene, and to her eternal credit, Angela has taken out a legal action against them. And I was with her this afternoon. We were talking about the progress of this and the crowdfunding that's helped her to take this action out. She's a local councillor, but also sadly has MS and therefore relies very heavily on her GP practice. And she, like all of us, utterly resent the idea that her GP practice is now run by an American healthcare company whose interest is not primarily the health of the people of Holloway. Their interest is the profits that will be handed back to their shareholders, in this case, in the United States. And so it is about challenging it at that legal action that's taken, and that I'm sure we can all get behind. And there is dozens of other cases. And I was listening very carefully to what Rabina was saying earlier from Tower Hamlets, and she was saying, like me, she didn't know it was happening in her own very own doorstep. I was in exactly the same position. The first time I heard that a private company had taken over a GP practice in my constituency was when I read about it, because campaigners told me they just discovered this was going on. And then we came on the demonstration that you organised, Jackie, outside their head offices on that beautiful, if very cold day. Mm-hmm. And so it is up to us to campaign on it, putting the pressure on legally, but also campaigning for the whole principle of our National Health Service, because it is under threat. It's under threat like it's never been under threat before. The staff have dealt with COVID brilliantly. The care workers and everybody else, incredible efforts that have gone in, and all the volunteers and everything else. And what's the reward? More privatisation, more handing over contracts to Serco and everybody else, which diminishes our ability to deliver a holistic health service. And I was at the demonstration organised by People's Assembly and a number of unions on Saturday. And the point I was making was that we have to defend our NHS, of course, and we all do that. That's why we're here. That's what gets us out of bed in the morning. That's what keeps us going. But it's not enough. We get people behind us when we defend, but also when we demand. And so I hope that what I heard earlier that others were saying, I think it was Marie-Louise was saying, that there's to be a sort of more comprehensive approach put forward of what we demand from the NHS in the future. And I absolutely support that idea, because I want to see an NHS free at the point of use. I want to see it prescription charge free. I also want it to be extended into the issues of social care. As I pointed out to the rally on Saturday, probably half the people that filled Parliament Square last Saturday would, at some point in their lives, need some form of social care. It might be a daily visit from a care worker. It might be something even bigger than that, permanent care worker, care help, and so on, all those things. It should not be decided by a postcode lottery. It should not be decided by the value of your house. It should not be decided by the ability of your children and family to pay for your care. It should be part and parcel of the principle of healthcare free at the point of need. And as a country, we could well afford to do that. We can't afford to do it unless we have a better taxation system. We can't afford to do it unless we have some reallocation of spending priorities in government. And I can think of lots of areas that you could reallocate that. But it is about that, and it is about funding of mental health and so many other things. Our call today is a call to action. All of us to take action in our own communities this weekend in defending our NHS, stopping our GP practice being taken over by Centene. And I see there's going to be a demonstration in London on Saturday. Sadly, I cannot be at that one because I'm going to be at a demonstration in King's Lynn, supporting their campaign to defend the health service there. But I think what you said earlier, Jackie, about a big NHS Day demonstration outside the Department of Health next Monday night, 168 hours from now, would be a really good idea. And there's no better place to demonstrate. It's in Whitehall. There's loads of journalists around. There's lots of TV nearby. Let's do it and show that we are actually determined to defend our NHS. It's not for sale. It's not going to be put on sale so long as we're around, and we've got to defend it at every inch of the way. And it means, I'll finish on this, saying to patients when they go to their GP practice, watch it. Your practice is on sale. Watch it. Your data is about to be given away by the NHS to commercial purposes that will use that data to further invade the precious space, which is our NHS and the medical research which our NHS is capable of. And absolutely last from me, we invested, the public, a lot of money in the vaccines, yet the intellectual property is owned by somebody else. Big Pharma is making a lot of money in this country and even more all around the world. There's never been a better time to make the case for universal health care via the World Health Organization on a global basis. And let's defend what we've achieved in our NHS, but make it even bigger and even better than it already is. But we're not going to do it if we just talk to each other. We're going to go out and talk to everybody else. Jackie, thanks very much. Sorry if I went on a bit too long.
Nope, that was perfect. Thank you very much. That was absolutely great. No, you didn't go on too long at all. And absolutely a call to action. We mustn't talk to each other. There are nearly 500 people here. That's absolutely fantastic. And I'm sorry about the Facebook link because I think there would have been more people there too. But we're going to put the meeting on we're going to put it on social media. But absolutely, there'll be things happening near you on Saturday. If you don't know about them, Kipper NHS public website, go and have a look for your local activity. But next Monday evening, 6 o'clock, outside the Department of Health, there will be a demonstration. Please come to that. We'll put more details out. We'll circulate details, but there will be a demonstration outside the Department of Health next Monday, the NHS 73rd birthday at 6 p.m. So if you're in London, please come. Okay, so thank you to all our speakers.